visual scanning and collision avoidance. So, how long do you think it would take if two aircraft were approaching each other at 360 miles an hour from 10 miles out? They would have 100 seconds until a collision. So, how about 4 miles? Two aircraft, 360 miles an hour, 4 miles apart. How long until they collide? 40 seconds. What if they're a mile apart? 10 seconds. Half a mile. 5 seconds. So, you can see it's important that we look out for other traffic. There's a mile difference between these two aircraft, yet they only have 10 seconds to see and avoid each other. So it's very important that we're constantly looking out for other traffic. So, even though the sky is a big place, mid-air collisions do unfortunately happen, and it's not uncommon for them to be primarily around airports. And the shocking thing is that the majority of mid-air collisions happen in clear weather days when you have a million miles of visibility, sun's out, not a cloud in the sky. That's when these mid-air collisions happen. So, how do we avoid it? First is our vision. Our vision is the primary tool we have for reducing the risk of collisions. And just for safety in general, visual scanning and collision avoidance is important to creating safe skies. So, a developing a visual scan to avoid collision threats is paramount to the safety of all pilots. FAR 91-113B states, when weather conditions permit, regardless of whether an operation is conducted under instrument flight rules or visual flight rules, so even if we're on an IFR flight plan and we're flying under IFR, but also visual, vigilance shall be maintained by each person operating an aircraft so as to see and avoid other aircraft. Basically, when you can see outside and you're not an IMC, you're responsible for seeing and avoiding other aircraft. It's often a shared job, so even if you have passengers, brief them and let them know to also scan for traffic, but the pilot is always responsible in seeing and avoiding other traffic. So, again, you are responsible for those safe air operations. Mid-air collisions are always possible, even if it's IFR or VFR. If you can see outside, it's your responsibility. And all pilots are equally responsible despite aircraft size or type, and our eyes need to be 90% outside, 10% inside. So this is how we scan. Our eyes see a roughly 200-degree horizontal arc, and yet only a small area in the center of our vision is what sends that clear image to the brain, and this is the fovea. So our fovea is the center of vision. It sends a clear and sharp image to the brain. It's effective in daylight, but it's effectively a blind spot at night. So during the day, to utilize the fovea effectively, we scan doing short series, regularly spaced eye movements. So if I start right here at the center of my cockpit here, I'll do it like 10 degrees here, then move over, then do another scan, move over. And this is how our scan continues. So some people do left to right like this. Some people do, from the center left, center right, or right to left, left to right. Whatever scan works for you, but what's important is making sure you're doing about these 10-degree scans all across the your dashboard. Scan 10-degree sectors with 1 second pauses between eye movements. So check here, check here, check here, check here. If another aircraft has no relative motion to you, so say I spot other traffic out here, but if they have no relative motion, then they're on a collision course towards you, and then you need to make a change. So we have some limitations to our vision. Again, I said the fovea is that small section in the center of our visual field that gives us that that sharp image that gets sent to the brain. We actually have a blind spot. It's an area on each eye where the optic nerve attaches to the retina, where there's no cones or rods, and it's completely blind. So we can see off our right eye, the blind spot kind of goes off to the right, and the left eye kind of goes off to the left here. So if you look at this image, it might be hard on a phone. It's easier because it's like on my computer screen right here. But if you cover your left eye and stare at this red dot here and you get the distance right, you cannot see this little plane on the right side. And so that's a little exercise you can do just to showcase that blind spot that we have. Day versus night vision. So there are two types of cells in the retina: rods and cones. Cones responsible for all color vision, but has poor light capability, so it's best in our daytime. Cones is responsible for vision during the day. Rods are responsible for our vision at night, so responsible for our peripheral vision and detecting objects, particularly ones that are moving. So during the day, our best vision is using our cones, so what we're staring directly at. At night, since our cones aren't as responsible at night and our rods are responsible, our best area of night vision is on the extremities here. So that means off-center viewing at night is better than the scan that we would do during the day with these 10 degrees. We're going to utilize off-center viewing when we're scanning for traffic at night. Our night blind spot is right in the center. So because the fovea is populated by primarily with cones, the center of our visual field is only usable during well-lit situations. At night, when the vision provided by rods dominates, there's effectively a night blind spot in the center of our vision, where the lack of rods in the fovea create an area of low light blindness. To account for this deficiency, pilots must use off-center viewing at night. Barriers to visual scanning. We could have blind spots like, so we're flying in a 172 a Cessna high wing like so we have a blind spot above. Something like a Piper aircraft or a Cherokee or whatever will have a blind spot beneath them because of the low wing. We have limitations to our vision, our human visual system and limitations, aircraft blind spots for the high and low wing, and glare field reflection in a dirty windshield, especially in the summer months where you're going to be smashing into a lot of different bugs, and all of a sudden little dots on the windshield you think is traffic, but then it's just a bug or just some smear on your windshield. If that's not properly cleaned beforehand, then it can make it much more difficult to scan for traffic. So, tools for reducing collision risks: using sunglasses, crew resource management, so asking the other pilot or for passengers to also help you scan for traffic, although it is ultimately your responsibility. Aircraft lighting, so flying with our landing lights and strobes on at all times to reduce risk, so to illuminate the aircraft, so make yourself more visible. Flying with nav lights on at night as required. Even having those nav lights on during the day is not a bad idea. Talking on the CTAF and making your practice area radio calls. So using proper radio calls to let other traffic in the area gain situational awareness on what you're doing, where you are, and what you're planning to do. Understanding the right of rules and obeying these right of rules, operating right of way rules, non-tower operation procedures. We're going to have proper pattern entries, pattern flying, and pattern departures. And when we're talking to ATC and using flight following, might as well have flight following when you're doing a cross country, especially if you're flying at night, to have an extra pair of eyes on you so that they can let you know of other traffic in the area. So, mid-air collision risk factors, the relationship between aircraft speed and collision risk. So fast-moving airplanes, of course, will converge more rapidly and create a higher collision risk. Any situation that involves greatest risk anywhere many airplanes are converging is a high risk for collisions, like at an airport in the traffic pattern. We can see on final approach and on the runway is the largest, makes up the largest mid-air collisions for traffic in a traffic pattern. Practice areas, additionally, also that have high volume training operations going on, can have an additional risk for mid-air collisions. The vast majority of mid-air collisions occur, again, non-towered airports during day clear conditions. So just because it's clear conditions outside, don't get complacent. Remain to have a vigilant scan and make those radio calls. Before takeoff, scanning and the approach and departure areas for traffic. During climbs and descents, using gentle banks to permit scanning. In straight and level, we're doing our normal scan. Traffic patterns, we're scanning and making our traffic pattern, our radio calls. Again, during training areas, in high, practice areas where there's could be a high volume of traffic, we're doing our clearing turns and making our radio calls and being aware of our blind spots. Looks like I kind of said all this beforehand, but yeah, before entering runways, climb, descent, straight level, before maneuvering, before landing, recognizing the hazard. So, collision course, if an aircraft, again, has no relative movement, we're on a collision course. So, traveling at 100 knots, which is a lot closer to the airspeed that we'll be flying in our 172. If they're 10 miles out, 5 minutes till we collide. 4 miles, 2 minutes. 2 miles, 1 minute. 1 mile, 30 seconds. 1 mile is a pretty big distance, and so for these aircraft to be colliding within 30 seconds means that's not a lot of time to see, avoid, and take action for an aircraft that's within a mile away. So take action within the FARs if available, but do whatever necessary to avoid a collision. So our physical condition can have an effect on our vision. Our vision is dependent on being in a proper physiological condition. Fatigue can reduce visual acuity. Hypoxia greatly impacts visual acuity. And so in the pre-flight, going through those I'm safe factors will all affect our vision. And so if we run into fatigue, hypoxia, or any of the I'm safe factors, that will affect our ability to take on that responsibility of seeing and avoiding other traffic. Additionally, environmental conditions. So small dim lighting and small print colors can become harder to read. Dark adaptation, especially when we're flying. For flying at night, our eyes become more sensitive to light. So to become completely adjusted to the dark, it takes about 30 minutes. And bright lights cause your eyes to lose dark adaptation. Additionally, smoke, haze, dust, and fog, anything that reduces visibility can cause empty field myopia. So this is when there's nothing for your eyes to focus on, so they relax, and objects like the runway when we're trying to land seem farther away than they really are. All right, let's get into the vestibular and visual illusions. The human brain is highly dependent on the visual and vestibular systems for determining orientation and position. Mainly our visual system that gives us the largest source of information for our orientation. These systems are subject to several kinds of illusions that can cause spatial disorientation. That's where we get into our ICE flags acronym for our vestibular, in-flight, and visual illusions. So we'll go through our inversion illusion, Coriolis illusion, elevator, false horizon, leans, autokinesis, graveyard spiral, and somatogravic illusions.
Hi.
Oh, that is so loud. I'm going to skip that. All right, inversion illusion. The inversion illusion is an abrupt change from climb to straight and level flight. So the illusion can create the feeling of tumbling backwards. So the disoriented pilot will abruptly push the aircraft potentially into a nose-low attitude, which can further intensify the illusion. The next is our Coriolis illusion. This is when we have an abrupt head movement in a turn. So once we're in a turn and our vestibular system equalizes, any head movement in this condition can create the illusion of rotation or movement on an entirely different axis or an acceleration on a completely different axis. So the pilot may maneuver the aircraft into a dangerous attitude in order to stop the perceived rotation or perceived, movement on a different axis. So you'll see examiners put you in a prolonged turn, all of a sudden ask you to pick up a pen on the ground, and then you'll experience this Coriolis illusion. So you have to be aware of that. The next is our elevator illusion. So any sort of abrupt upward, downward, vertical acceleration, most likely due to an updraft or a downdraft, will create the illusion of being in a climb, or if it's in a downdraft, being in a descent. So the disoriented pilot may push the nose into a nose low or nose high attitude based on if they're receiving an up or downdraft, when really they should be keeping the aircraft's nose level, or potentially at a VY climb if they're in a strong downdraft. False horizon. So false horizons are either a pattern of lights like we see in the picture, or maybe sloping clouds, or an obscured horizon that the pilot perceives as being the correct horizon, but is actually false, hence the name false horizon. And the disoriented pilot may put the aircraft into dangerous bank or pitch attitudes in reference to this false horizon rather than trusting their instruments. Next we have is the leans. So an abrupt correction of a bank entered too slowly can stimulate the senses in the inner ear to go undetected. So if I enter a gradual bank, it can go undetected by our vestibular system, causing us to be at a slight bank and to be cruising at a bit of a lean. So even after correcting back to wings level, since the vestibular system equalized at a left bank in this example, it'll feel like the vestibular system will feel like it's in that bank to the right. So the pilot may turn back into the original undesired bank and continue to fly at this slight bank attitude. So pilots will fly kind of leaning to one side or the other, which is why the illusion is called the leans. It's the most common illusion that's encountered in flight that you'll definitely run into, and I definitely ran into it in my flight training. So understanding you should just trust your instruments and really kind of suppress that feeling and rely solely on your instruments because they won't lie. Our next illusion is autokinesis. So if we are flying at night and there's darkness and we have a static light that we're focusing on for an extended period of time, that light will appear to move on its own. So we want to prevent ourselves from orienting our aircraft based on a singular light at night because of autokinesis and that light moving on its own. Next is our graveyard spiral. So a pilot in a prolonged turn may feel like they're straight and level. What we know about being in a bank angle is when we're at a bank, we need increased vertical component of lift, and we do that by increasing back pressure to maintain altitude. And the more the pilot does that, they're getting in a higher pitch, higher bank attitude, and further increases in back pressure will increase the rate of descent and tighten the spiral. Loss of altitude during a turn, stop stimulating the motion system, creating the illusion of wings level, even though they're in a descent. The pilot may pull back on the controls even more, tightening the spiral, increasing the loss of altitude. And then we have the somatogravic illusion. So deals with the acceleration stimulating our otolith organs. So if I accelerate, that can create the illusion of a nose up attitude. If I decelerate, it creates the illusion of a nose down attitude. So the disoriented pilot may put the aircraft in a nose low dive attitude, or if they're decelerating, in a nose up stall attitude. All right, that's about it. That was a quick one there for the visual scanning and collision avoidance.